Maja, I've tried everything. Sprays, herbs, but nothing changed. I just want to be a mother.
Child, I have seen many like you. Sometimes the answer is in a forest, but it is in a hospital.
What do you mean?
There is a treatment, IVF. It's not a black magic, but it's science. But it needs faith too. Faith in healing.
A few moments later.
While IVF is a journey, it may take time, but if many couples hope, even Maja believes in it, that's means something. Then, let's begin with science and with belief. Sometimes the wisest advice may come from the way you least expect it. Trust science, trust me.
IVF is a fertilization process done outside the body, where a woman's egg is fertilized by sperm in a laboratory. The process involves monitoring ovulation, retrieving eggs from the ovaries and sperm, and fertilizing them in a lab dish. The resulting embryo is cultured for 2 to 6 days before being implanted into the woman's uterus to achieve pregnancy. Why is it done? Actually, IVF is a treatment for infertility or genetic problems. Sometimes, IVF is offered as a primary treatment for infertility in women over age 40. IVF can also be done for certain health conditions like fallopian tube damage or blockage, ovulation disorders, endometriosis, uterine fibroids, and impaired sperm production or function. This graph shows the percentage of successful IVF treatments among different age groups. From the graph, we can see that the highest success rate is in women under the age of 30, with a success rate of 74.1%. This means that younger women have a higher chance of getting pregnant through IVF. As age increases, the success rate tends to decrease. For example, women aged 31 to 34 have a 96% success rate, while women aged 35 to 37 have a lower rate of 57.7%. The success rate continues to decline for those aged 38 to 40, dropping to 47.4%. Interestingly, for women above 40, the success rate is slightly higher at 50%, but still much lower than the younger age groups. This graph clearly shows that age plays a significant role in IVF success, with younger women having a better chance of conceiving through this method. Therefore, couples who are planning to start a family through IVF should consider the importance of timing and age.
Ovulation induction involves administering medications to stimulate the ovaries to produce eggs. These medications act to increase follicle-stimulating hormone FSH, causing the ovaries to produce eggs. Egg retrieval. Egg retrieval is done 34 to 36 hours after the final injection and before ovulation. The woman is sedated and given pain medication. Using transvaginal ultrasound aspiration, a probe guides a thin needle through the vaginal wall into the follicles. Eggs are suctioned out, usually in about 20 minutes. The retrieved eggs are placed in a culture medium and incubated. Matured, healthy eggs are then mixed with sperm for fertilization, though not all will fertilize successfully. Sperm is retrieved by inserting a needle through the scrotum into the epididymis, pesa, or testis, tesa. This works well in obstructive azoospermia with nearly 100% success. For non-obstructive azoospermia, where the testicle makes little or no sperm, more invasive methods like TSE or micro-TSE are used. TSE involves taking small testis biopsies. Micro-TSE, available only in some centers, uses a microscope and has a higher success rate, about 50%. Then, retrieved sperm is frozen and stored. For fertilization, it compares two methods. First, conventional insemination. For this method, healthy sperm and mature eggs are mixed together in a lab dish. It is used when sperm quality and counts are good. For second method, intracytoplasmic sperm injection, ICSI. A single healthy sperm is injected directly into each mature egg using a fine needle. It is used when there are issues like low sperm count, poor motility, or previous IVF failure. For embryo transfer, the woman might be given a mild sedative. The doctor will insert a long, thin, flexible tube into patient's vagina through the cervix and into the uterus. A syringe containing one or more embryos suspended in a small amount of fluid is attached to the end of the catheter. Using the syringe, the doctor places the embryos into the uterus.
Have you ever wondered, is Islam allowed us to do IVF?
Let's watch the fatwa behind the IVF treatment.
Woman is desperate for a child and Allah Azza wa Jal did not bless them with one, so she would like to opt for IVF. And the majority of scholars, the contemporary scholars, say that this is permissible providing that the sperm is from the husband and the embryo is from the wife, and the pregnancy takes place in the wife's womb, so there's no third party involved. And it is needed and it's a must and it's highly recommended that this is done in an institution where sperms cannot be mixed, because this is very vital and important, and highly preferable and recommended that the treatment of the IVF would be done by a female doctor, so that we would not expose the woman to non-mahram men without necessity. But if this is not possible because there aren't any women who are qualified to do such work, then inshallah it's permissible. But the previous conditions are essential. The sperm is from the husband, the embryo is from the wife, and the wife is the one who's carrying a child in her womb, and may Allah Azza wa Jal grant them the children that would satisfy them.
In conclusion, many couples in Malaysia struggle to conceive after a year of unprotected sexual activity, making infertility a serious and expanding issue. Consequently, IVF stands out as one of the best solutions for this issue. Our investigation has revealed the most recent information on the success rate of IVF, its steps and procedures, and the fatwas or verses from the Quran that support it. In addition to offering a medical remedy, IVF gives many families their hope and mental health back. For infertile couples in Malaysia, IVF can be a life-changing procedure with the right advice, ethical concerns, and medical assistance.